component in the trolley. I will show you the component in the trolley. The trolley component should be, there should be the gloves, pair of sterile gloves, and for to clean the vulva, the swabs and the sponge holding forceps, Cusco's speculum, and the instrument which are required is the iris spatula. You can see this is the iris spatula. It is available in the two forms. One is the plastic or plastic form. This is the plastic, and other is the wooden. It has the two parts. One is for the pinpoint menopausal females who has the pinpoint cervix, or the primary parous female who has the pinpoint cervix. This end could be used, but this is a sharp pointed end. And this blunt end is used for the multiparous female who has the petulous cervix, and that can be this long arm is adjusted easily in that multiparous or the petulous cervix. So the second one is the cyto brush. You can see it's a brush like we wash the bottles with the brush. It has some bristles. It is on this cyto brush is only used for taking the adequate sample from the endocervix. As as we all know, there is another technique by which we can have a Pap smear. This is called the cyto broom, which has the flexible bristles over there, and it has a long end which fits into the endocervix and take the sample all from the endocervix as well as the ectocervix, like the spatula, air spatula. But if there the transformation zone has receded inside the cervix, this cyto brush can also be used for the taking the adequate sample of the endocervix of the transformation zone or endocervix. So this can be used additionally. But there are the certain studies says the combination of this cyto broom and cyto brush have a good by using these two, this can have a good sample from both ectocervix as well as the endocervix. Thus, according to the FDA approved protocol for this Pap smear, this cyto brush is only sufficient. But certain practitioners use this cyto brush as well for taking the sample from the endocervical canal or from the endocervix. So this is the spray for the fixation of the glass slides, because the fixation of the glass slide with 95% alcohol is required, and the glass slide should be there should be the two glass slides, and they should be properly labeled. If there is a patient who has a hysterectomy previously with some cervical disease, you have to go for the wart smear, but only one slide can be used for that. So there are these three ways by which we can take the cervical smear: by the iris spatula, with the cyto brush only for the endocervical canal or endocervical sample, and this is the cyto broom that can this is the liquid based cytology. This cyto broom or the liquid based cytology is better as compared to this iris spatula, because if by this we can have a adequate sample like 80 to 90% cell we can get from this cyto broom, and there is a non drying effect. Even with this cyto broom, when we put the sample, we put this brush in this vial, that is the vial for the to carry the sample, to carry this brush to the laboratory. So we HPV DNA testing can also be done. How we can perform this procedure? To performing this procedure, you have to just clean the vulva only from the outside. From the outside, no need to clean the vulva from the inside. If there is no vagina, if there is a vaginal discharge, then you can just wipe the this discharge with the dry sponge, and the trauma should be less to the cervix. So this is the Cusco's speculum, which is required to expose the cervix. So I have to put this after taking the consent. I will put this Cusco's speculum to expose the cervix. I will try to expose the cervix. Show from the back. Now it's visible, the cervix. This is the cervix. If there is a vaginal discharge, we just with the gentle hand, we just can clean the cervix. But there should be no trauma to the cervix. After that, you have to take the iris spatula. This iris spatula should be inserted inside the cervix. The long prong is the inside the cervix, and this should be at the ectocervix. you have to put inside and should rotate through 360 degree in clockwise direction. So I can also show here on the model. You have to put inside and you have to rotate it through the 360 degree. After that, if it is a pinpoint cervix, then you can, or the primiparous or the menopausal, so you can insert like that, and you have to rotate it through 360 degree. I can also show it inside the, it's easily fittable, so you can rotate it through 360 degree. After that, you have to smear that sample on the already labeled glass slide. And how you will, you don't have to touch the slide, you have to smear like that on the one slide, and